Well, our next panel are going to be folks who aren't here because they have to care, but because they do care. Because we've seen what happens when an employer doesn't care that their employee has access to child care. They know that that's not a happy ending. So please join me now in welcoming to our stage Cheryl Johnson from Bronson Healthcare. Cheryl, where are you? Hello, come on up. Join us. Andy Richards from Duncan Aviation. Come on up, Andy. Lauren Kaiser and Leslie Kuchar from Kalsec. Are they here? That's Leslie. Okay. Did I say your name right? People say mine wrong all the time. It's Poucher?
Yes.
It's 50-50. Great to see you. Come on up. Hi, Cheryl.
Hey, how are you?
Nice to meet you. Andy, I love your name.
Where should we be? Should we be close?
It's a strong name.
This is good. Yeah.
All right, guys, what did you think of the talk show before? With all of our representatives, welcome to our stage. We're going to go right down the road. Leslie, we'll start with you. Tell me a little bit about you and your organization and how you're helping this child care coalition and contributing to progress. I think you're on.
Oh, it's on. Is it on?
I don't know.
No.
Let's try. Keep talking. Say mic check, mic
Now
check.
it's
There we go.
I'm Leslie Poucher. I'm one of the directors at the Farmhouse Early Learning Center, which is on-site childcare at Kalsec. Kalsec is a company of about 500 employees internationally, and in Kalamazoo, we have 350 on-site. So we provide on-site childcare and preschool, high quality, to the employees and the grandchildren. So the employees can send their kids to our center, and also the grandparents can send their grandchildren to our center.
My gosh, what a great thing that is.
Yeah. Kalsec is 68 years old this year. They are a spice and food ingredient company, and this is the third generation of a family-owned business. And that third generation is Martha Todd. And 9 years ago, she decided she wanted to make a big difference and turned an old farmhouse on the property into a child care center for us. So we're 9 years old, and we have served about 120 students so far.
So many adults, you know, they're parents, and then they become grandparents, but then they become primary care providers for some reason, and then they need to keep working. So you found a solution to that.
We did. Yeah.
That's pretty unique. That's great, Leslie. Thanks. All right, Cheryl, let's talk about Bronson and how you have helped facilitate affordable, accessible childcare for your employees.
So good afternoon, everyone. I'm Cheryl Johnson. I don't know if anyone has had to seek medical care recently, but if you have, you probably experienced we're very, very busy. There's just a high need, and patient access is very important to us. There are 9,444 healthcare providers at Bronson across southwestern Michigan, so we are probably one of the largest employers in the area. And 88% of our workforce are Zs, millennials, and X, which means that a large percentage could be in the family planning life cycle. But to your point, Leslie, we also have grandparents that are raising children as well. And so we understand that the need is quite high for us. We have about 3,599 kiddos that are 12 years and under. And so what we're really looking at is this village effort. Leslie, we did come in to visit your wonderful child care center, and it really inspired us. And so you'll hear a little bit about the village effort that we have to provide accessible and affordable child care.
You know the number of the employees' kids that you have? 3,000 something?
3,599 kiddos.
Wow.
Under the age of 12.
Well, that's good that you have that number, and that's so important to you. Wonderful. All right, Andy, Duncan Aviation, what are you guys doing to contribute to this mission and help your employees with childcare?
Thanks. I'm glad to be here today. Andy Richards, COO for Duncan Aviation. Duncan Aviation is a family-owned business. We work over in the Battle Creek Airport. We've got 850 employees. The company's been in business for 70 years, and we've been on the airfield of Battle Creek for almost 40 of those years. So really happy to be part of this community and an employer for the community. So we first became aware of the crisis during the pandemic. And back then, during the lockdowns, of course, childcare facilities had to be closed as well as part of that lockdown procedure. And so families were scrambling on what they were going to do with their kids, right? Just like everybody else in this room, trying to figure out how they're going to occupy their time and take good care of them. But as those lockdowns lifted, the crisis seemed to remain. And this is what was surprising to us is the child care providers came back, but not in the force they may have been prior to the pandemic. And so we lost a lot of capacity in that time frame. And I had already been aware of Pulse, but I really leaned into Pulse as an organization to educate me on what was going on, why we had a child care desert, why we had a child care crisis, and why my team members that worked at Duncan Aviation couldn't find the child care they needed. And so leaned into that, got curious, as was mentioned on the other panel, how important that is, to figure out, okay, what can we do? So in addition to being flexible with hours and those types of things that everybody was doing, we also came up with a dependent care benefit, dollars that were put into someone's and team member's benefit that they could use to take care of child care costs or elder care costs, as the case may be. So that was one way that we attacked it.
So the child care desert was a surprise to you, because it was to me.
It really was. I mean, I knew
Post-pandemic, yeah.
Yeah, exactly. It was shocking that we had a 40% shortfall in this area as far as required slots were concerned.
Yeah, Leslie, what surprised you the most when you started learning about this child care issue and the need for it?
I think my biggest surprise is how big the gap is between having a cost-neutral spreadsheet and what people really, like what the reality is and what childcare workers are suffering through just to do the really, really hard and great work that they're doing, as far as the income goes.
Yeah.
And there was a lot of work that had to be done because we were blending, we had a board, we put it together, we were blending educators and corporate leadership. And so we had to figure out a lot of things there.
I bet. A lot of things.
A lot of things.
I bet a lot of things happened
A
over
lot of
Bronson
things.
too, Cheryl. What surprised you the most as you started delving into this issue?
So I won't say that I was surprised. I think I have lived experience as a working mom. My husband and I, our children are now in their 30s. But just the challenge of trying to find high quality, accessible childcare has been a journey. I mean, I do understand the impact of COVID, but I think working parents have really struggled with this issue for a long while. And I was blessed to have an expat assignment over in Switzerland, and I love the way the Europeans think about childcare. They actually have daycare centers for children up to 4 years old. And so I often thought that, man, we could learn as Americans how other countries have tried to figure this out. So I wouldn't say that I was shocked, but hopefully we will propel this issue of childcare because we need working parents to be fully focused in the workplace.
Andy, how do you think supporting child care at Duncan has benefited the workforce and benefited the company in general?
Well, I think that the reason it's benefited the workforce is that they feel listened to, because we conducted not only anonymous surveys about childcare challenges that they're facing, but we've also held multiple listening sessions with groups of parents in a big room, listening to what's going on with them, about the long wait list, up to for 1 to 2 years being on a wait list. The affordability issues have been mentioned. So I think the benefit for them is that they feel listened to and supported. And then the other thing is, I've been somewhat public about my advocacy on this front with local and state officials as well as federal officials. So they know that I'm trying to move things along, not just within the company in our policies and our supports, but also getting other governmental agencies involved, government entities involved, because the market-based system is broken. If you're only getting $13.88 an hour on average as a child care provider, then you cannot afford to stay there when you can get better wages at a gas station or at a Dairy Queen. These are real stories that I've heard. And because it's a 1% to 2% margin business, the providers can't raise that pay because it's already not affordable for the families that are paying for it right now. So it's a catch-22. And so just being out there and advocating for solutions, I think, is a benefit to the team members as well as our company, because it does help with retention, right? All companies, all three of us up here, we have employees that we desperately want to retain. And so retaining that talent through showing you care, through actions that we've all taken, is the biggest benefit to our company.
Yeah, Cheryl, how have these initiatives that you're taking on at Bronson benefited the hospital system in general, do you think?
So I support what Andy is saying. It really is the return on investment as it relates to retention. There is a healthcare shortage in the industry, especially with nurses. And approximately, please don't judge me, I'm not saying that women are primary caretakers all the time, but oftentimes women have to kind of figure these things out. With 80% of your workforce being women who have to sometimes figure it out, it really helps with retention, engagement, productivity, patient experience. So there's a return on investment. It's just not this feel-good moment that we have. We are really finding the impact that it has on people being engaged, fully focused on the patient experience.
Now, Leslie, do you think that at Kalsec you're retaining, but B, attracting good employees and loyal employees because of what you're doing to help them with childcare?
Yeah, we sure are. We had a dad who was interviewing 2 years ago, was it 2 or 3 years ago? And came for a visit at the farmhouse and decided in the play yard, surrounded by all the kids, in the sand pit, that he was gonna accept the position because of what the company was doing. So yes, and he is one of the leading antioxidant through rosemary, apparently. That's not my wheelhouse, but
Sorry, what is this stuff?
rosemary, antioxidant.
No, there are a dime a dozen.
Yeah. So yeah, we see huge benefits. This morning, when I ran through to get here and was finishing a couple of things, I ran into a parent who was also running from the farmhouse back to the lab. She's got a tiny one who just joined us 3 weeks ago, and she runs over every time the baby needs to eat. And her supervisor absolutely supports her. People are handing her water. We're getting a more comfortable seat for her, and we welcome her in. And you know, it really hit me when people were talking about trust. And yesterday we got a message from this parent asking, okay, I think the baby's gonna need to eat right around this time. I need to train 3 new interns. What can I do? And our solutions were, well, we could walk the baby over to you during your training if she gets hungry, or you could do your training upstairs in our staff room. It's not very organized or clean, but you could do it there, and then if the baby needs to eat, we can walk her upstairs. And so that's just real-time benefits that are happening. That happened today.
That happened today?
That happened today, and then yesterday they had a training upstairs in the farmhouse.
These are solvable
So-
problems, right? And she's happy, the baby's happy, everybody's happy.
Everybody's happy.
The interns learned,
Yeah.
I'm assuming.
Yeah,
We'll
I
see.
think so. It
We'll
seems
see what
like-
happens.
Yeah.
What's one thing that you wish, Leslie, more employers understood that Kalsec does?
There's so many things.
I mean about childcare.
Right, about childcare.
Spices.
No, I don't even actually know anything about that. I do think the leaning in and trusting each other and listening, I think right now we really need to listen to childcare workers, teachers. They are doing such hard work, and we had a big win, well, I did, in my career. In the fall, Kalsec, the board, agreed to make sure that our wages were a living wage for all of our workers, and that has made a big difference. And it wouldn't be possible without having a company backing us and throwing that money into our budget. And there are so many centers that are doing really good work who don't have that. And so, yeah,
Good point.
there's one thing.
And Cheryl, what's one thing that you think other health providers, maybe Beacon/Borges, could learn from you?
Well, we can learn from them as well. So glad we have 2 very strong healthcare systems. So for us, it was also about affordability. We committed to a living wage about 4 years ago, our CEO, President Bill Nance, and so we have living wage too, but we also know that childcare is expensive. And so we engage in TriShare. For those of you that are not familiar with TriShare, it's a program where the employee pays a third of the tuition, the employer pays a third, and then the state of Michigan pays a third. And with that, then it becomes a lot more affordable. So understanding the affordability is the access for sure, but the affordability is quite important. So, yeah, that would be one of the many things I would love for people to always consider.
Yeah, same question to you, Andy. What do you think other companies could learn from Duncan?
Well, it's time for more employers to get engaged, period. Because this is a market problem. This is a workforce development problem, retention problem, participation problem. And so we should all be invested in this as employers. Not because, well, first of all, because it is the right thing to do to take care of our most vulnerable individuals in our society. We should be able to do that, right? Just for that reason alone. In addition to that, however, if we want to be a prosperous economy in Michigan, this should be taken up by employers and employer, the economic development agencies as well in the area to band together those employers to make even more of a unified effort in this cause, because I have lost team members because of child care related issues that come up. Either they're late to work, they have to leave work early, which we're flexible about, or they don't show up altogether because child care has fallen through. So we lose productivity, just like the other two employers do when this happens. We lose productivity, and we can't grow the way we'd like to as a company in this area. And so it's not just about us, it's about all the employers, it's about the society in general. Because employers have influence with our elected officials. Sometimes much more influence than individual voters do. It's time to use that voice to start making a difference, because it's going to take all of those entities that I named and more to get the ball rolling.
I think that transitions nicely into our last question for each of you, Andy. What can folks here do, the general public? How can they help your mission?
Okay, first of all, use your resources. We learned about a lot of resources in the former panel that was up here. So for us, it's been Pulse and ECIC, as well as other organizations that have supported us, educated us, and supported us, helped us figure out where we needed help and how to get that help. And so lean on your experts. Don't try and do this alone. The other panel that was up here talked about working as a team and sharing. We need to do that as employers too. It hasn't been seen as a traditional workforce or employer problem before, childcare. It's not like other things like training, right? But it is a problem for us, and we've got to engage in it.
And Cheryl, to you as well. What can folks here today, what can the general public do to get involved and help your mission of improving child care for your employees?
So I forget who said it, and whether you're a donkey, an elephant, or independent, you really utilize your civic responsibilities and vote, and really encourage your legislators to represent your best interest. I think that's the number one thing that we can use. And then I think through storytelling, telling our positive stories to other employers that this is a return on investment, this is a business case, is really important. So as much storytelling as we can have, and then use the resources. We too rely very heavily on Pulse. I want to also acknowledge that W.K. Kellogg Foundation, Bronson Community Partners, and Bronson came together to reimagine a child care center, which will be opening this summer. We're so excited for that. But again, it's a village effort. It wasn't that just Bronson Healthcare could do this alone. We really do need to figure out how the resources can come together.
Same question for you, Leslie.
Yeah, I think dream big, because why not? And be really persistent, I think. There wasn't a board meeting, there wasn't an event that happened at Kalsec that people started avoiding me because I was talking about a living wage for the child care center, and they were like dodging me. And it happened. It finally happened. There were enough people who got on board, enough examples. I got quotes from apartment complexes and the car wash down the street that our workers could go elsewhere, but they couldn't apply for the apartment across the street with what we were paying them. So I think just being really consistent and be the squeaky wheel and keep advocating.
Finally, in TV news, there's an expression, tell them what you're going to tell them, and tell them what you told them, right? It's all about messaging and branding and being on brand. And you guys are all committed, all of your hospital, your two companies, to childcare. What's your messaging structure? How do folks know when they're applying what a perk that is and that you are so accommodating? Is that on your website? Is it on your social? Can you be doing better in that area?
We can be doing better. We're working on this. I've got a new initiative for this.
It's important, right?
It's hard for people to see us because we're internal, and I think it's gonna be important for us to get our brand out there a little more so other people feel inspired. So yes, we could do better. HR does bring new hires through the farmhouse, so we do that.
Yeah, Cheryl?
We can be doing much better. We have what we call the Bronson experience, but sometimes the best way to get the message out is I will just say, hey, I've got some gossip for you. And then people spread the word really quickly.
We could also be doing better.
Okay.
But in addition to the traditional stuff like orientation, where we tell everybody about our benefits and what's important to us as a company and our values, we also have ERGs, so employee resource groups, that meet on a regular basis and talk about what's, what are the challenges, right, for the families that are working for us, and share resources, share ideas, those types of things.
Andy, Cheryl, Leslie, thank you guys. What a great Q&A right now. Okay, guys, wait, you're not done. This is why we need a teleprompter.
I know, we do, sorry.
If there are questions from the audience, do we have a mic for that, or will they?
I'm gonna grab one of them.
Let's grab
And I'm
one.
gonna walk back there.
I didn't get a chance to do this earlier,
Yes,
that's
I
true
have.
enough. And just let us know what your question is and to whom it is directed.
These tables are really, really tight. Hi, thank you. Hello, my name is Karen Gallagher. I'm with the YMCA of Greater Kalamazoo. My question is for all three of you. And I'm newer to the childcare area, so I am learning. But my question is, all three of you have programs that support your employees and are great advocates for those programs, it sounds like. And as you were all saying, you could be doing better in, I suppose, promoting those programs and making them known. I was wondering if the way business works, if you think in doing better and promoting that, promoting to other businesses what you're doing, do you think that would have an impact and inspire them to start searching how to create their own programs?
Thanks for the question. I mentioned earlier economic development organizations like Southwest Michigan First, Battle Creek Unlimited, and others that are in the region. I think that's a great way to share that information between companies, share ideas and benefits that they've tried, because we've only had 3 up here right now, and there's so many companies out there that are probably doing great work that we just don't know about.
Yes, and so I chair the Michigan Hospital Association HR Council, and and that's throughout the state of Michigan. I do share, and then they share as well. So again, we can always be competitive with each other as well, and so it's that sharing, I think that's very helpful.
Yes. Yeah, I think the Todd family that has owned Kalsec for 3 years is a very humble group of people, and it's hard for us to get them to do a lot of marketing and sharing, but we're getting out here a little bit more, and we keep getting asked, and so I think it is really important that companies see an example of companies that are doing it. Yeah.
Any more questions from you guys for these folks? At all? Feel free to ask anything that comes to mind.
Hi, I'm just curious if you could speak to, if you have second and third shift employees, how these solutions, if they are available to them and what that looks like, or if there's other strategies you deploy to meet their specific needs.
Yes, we are 24/7.
Yeah.
And so when we're building Garden of Dreams, that was one of the things, often they're working 12-hour shifts. So Garden of Dreams for us will open at 6 a.m. and they'll close at 7 to be able to accommodate that work schedule. Obviously, Tri-Share is a monetary benefit, and so that would help 24/7. In fact, most of our 12-hour shift people have also said that they don't necessarily look for a traditional daycare. They've figured out home solutions, if you will. So that's why Tri-Share for us is a real win-win situation. And, I acknowledge that being a working parent is really hard. My husband and I just had our 2-year-old grandchild, and I'm still trying to debrief from all the trauma. I literally, when we were playing with Play-Doh and went to the dryer just for maybe 15 seconds to load something up, and I came back to blue teeth. He had decided that he was going to eat the dough, so the Play-Doh. So I was in a panic and thought I'd had to rush my child to ER and try to explain to my colleagues what was going on.
And our benefit is also a monetary benefit, so it's for everybody.
Yep, this is tricky. We tried for a little while to have an overnight staff person who could have the kids overnight, and we had to reduce that program, because of staffing.
Mhm.
And it is our biggest challenge, is staffing, making sure that we have staff that are consistent. So we've had several meetings with third and fourth, third shifters, we have third shifters, to try to come up with a solution, and we have not found a solution yet. We've had a couple of kids that are dropped off in the morning by one parent. Sometimes there's 2-parent households, so the one parent drops off, and then when the parent is leaving their shift at 2 or 3, they come and pick up their kids. So we have done that before, yes.
All that coordination. We have a question right here.
Yeah, I'm just wondering about the data. You all talked about the return on investment for this as employers. Do you have like correlation data, anecdotal evidence, or is it like actual like causal links that you're seeing between for retention?
150% of an annual salary to replace somebody. And as I said, we've lost lots of people because of childcare related issues. Out of one department, half my attrition last year was due to childcare. And that 150% I threw out there is specific to us. But it can range all the way up to 200% depending on how much training is involved in the industry.
We have demographical data. Our turnover for nurses is lower than the national. National is 22%, we're about 16%. We also do exit survey data, and a percentage of our employees leave because of childcare as well. But then once we implemented some of these programs, we've seen a lot of progress. It's a journey, it's not a quick fix, and there are a lot of things that impact retention, but we do believe that we're making some really significant headway. Engagement is also important. And as we look at the qualitative data, a lot of comments regarding childcare and the appreciation of some of the things that we're trying to do.
We could do better. We're lifelong learners. We do have a lot of data that isn't well put together. And we do have a lot of parents who say that they do stay. We do annual surveys, and then they can group them into the farmhouse families. And they do stay at Kalsec because their kid's right there, or their kids are right there. Yeah.
The measurement success is important, great question. Who else has a question for the panel? Here in the back.
Hi, so I was running the question in my head while you guys were talking, and so give me a second. First of all, I've been in childcare for about 20 years, and I know that, and I mean in the classroom, and I know I don't hold a candle to the experience in this room. But I first of all want to thank you as employers and as businesses being here and acknowledging that it is a profession, which is, like everybody here can attest to, that is the #1 fight we all fight here. And I appreciate all that. My question is really, what does it look like as far as you being representatives of such large companies when it comes to, you just said, Andy, the weight that you carry with voting as a company as opposed to like an individual. So what are, what are the processes that you are leaning towards to help bring this up to those lawmakers to help us be seen more as a profession, I guess? if that makes any sense.
It makes a lot of sense, thank you. So what am I doing as far as advocating with elected officials, right? And so I'm meeting one-on-one with them. I've been doing this for the past 4 or 5 months. This year, I've set up these one-on-one meetings with, like I said, local officials, like our representatives here in town, federal officials, federal legislators, also was at the Mackinac Policy Conference on a panel similar to this one, advocating and talking to elected officials there as well about the situation. So it's one-on-one mostly for me is what I've been doing. But I am trying to get the economic development agencies together to collect us, right? So it's just not just Duncan Aviation or Andy Richards doing this, because I'm only one voice, even though I profess to have more power than the individual voter. I am still just one individual voter who happens to be running a company of 850. So it helps me get a place at the table for that one-on-one, but I don't know if I'm actually making a difference.
You're there, so that matters. Same here. Yeah.
I know that Martha Todd, who is Kalsec, did endorse in Kalamazoo the millage, right? Yes, yes, she did.
We have one more question.
Did Cheryl want to answer that one, or did you?
No.
Okay, yes, one more question.
Okay. This question is for those of you that have an on-site childcare center. I don't know if this is an appropriate question, but does your childcare center share a budget with the whole company, or is it separate, and is your childcare center profitable?
Education is expensive and not cost neutral, so Kalsec gives a lot of money, hundreds of thousands of dollars, so that the farmhouse can be the highest quality care for the kids. So we have our own separate budget that we run on, and Kalsec subsidizes into that. Yeah. So we need each other. Yeah.
So when we go into this collaboration, we went in knowing that it was not going to be a money maker, if you will. We don't even know that it will break even, but to Leslie's point and Angie's point, when you look at, and when we went to visit you, Leslie, the turnover of one engineer or the turnover of one nurse to replace a nurse is about $123,000. And so we look at correlations. It doesn't always mean that we can always look at cause and effect, to your point, but the correlation of being able just to eradicate some of the turnover really provides the business case.
Okay, any other questions? One question right down here in front.
So my name's Maddie, I'm the executive director of the Drop-In Child Care Center in Kalamazoo, but I'm also a mom to 4 in childcare. I'm a bio and foster parent. Sick days. They happen quite a bit when your kids are in childcare. Have you noticed, I know some parents get really like, my employer's gonna be upset, all these sick days are piling up, it creates a lot of stress and nerves on the employer. Do they feel more comfortable and less stressed because like, you have the child care center there, you can directly talk to their supervisor and say, no, they need to go home, and if you have that open communication, is it helping reduce that sick time stress of your employees?
We reduce the stigma through the culture that we have in our leadership at Duncan Aviation. We make sure that every manager understands that families come first, and that there should be no negative stigma applied if somebody has to call in because childcare fell through, or they're going to be late to work, or they have to leave work early because of some challenge with their childcare.
So we're not there yet. We're still on a journey. We had a collaborative with an organization in Kalamazoo that had dropped in, and their funding went away, though we supported some of that funding. So we still are on that journey, and we're not there yet. Of course, with patient experience and care, it can be difficult. So we're still working on that issue.
We have the advantage of knowing each other, so yes. Sometimes I get teased about it in meetings, but they really are supporting each other. There are some supervisors who are more supportive than others because they understand more, But if it comes right down to it, we've got a great relationship with HR, and if they have a question, they can just come over or text me or message me. So yeah, it is really important, all those connections and the trust that's being built.
I still feel real calling in sick on a Friday, but I do it anyway.
When you have to fly fish.
I summon up the courage, yeah, I want to go fly fishing.
Yeah, one of the biggest hurdles is the teachers who need to call in, because you can't be without a teacher. You can't run a program if you don't have a teacher. And so you can't be open. So we have had sicknesses run through that have had us close for periods of time. And that is, yeah, they're not just at a desk, that's important as well, but you can't be open unless the workers are there, so.
Do we have time for one more question or no? One more, I see another person back there.
This question is for Andy. Not to put you on the spot, but I was curious because you said that your losses are great when you lose employees due to childcare. My name is Celia from Southwest Childcare Resources. I was curious to know if, because you lose a lot of money when you have to retrain people when they leave and they take all their skill with them, is a childcare center in planning, or is it something that you guys can explore in the future for your staff?
We've explored it twice in the past 5 years, 4 years. There are a few different regional or national chains that we've consulted and gotten bids from to see what it would cost to set up a child care center at our company using a third party to run it, which is a little different than what Kalsec's doing. And it was cost prohibitive for us. Now, sometimes you can make the case through the numbers and convince people, and sometimes you can't. I haven't been able to convince everybody yet. So yes, it's still expensive when we lose people. Absolutely, it is. But we haven't been able to reach that tipping point where we will build our own center.
I'll come with you and invest in.
She'll come.
You'll come? Okay, great, thank you.
Might work.
Can I offer, I just want to offer one thought to that. So we don't think Bronson should ever be in the child care business. I screwed my children up really well, so that's not an area. We see it as a profession, and so for us, we're always looking at ways to develop collaborative relationships with people that are professionals. You guys want us focused on neurology, oncology, orthopedics, etc., not on raising and developing and teaching children. So it's not always the right business model for employers to try to do their own thing.
See, Leslie, you got this one. You keep saying you can do better, but you're doing this one.
Yes.
You got the child care center.
Yes.
Wonderful.
And we've got one last question.
I'm sorry, but so I have run into employers say that they can't engage in family-friendly policies because it would be inequitable to those employees that do not have children, and that it would breed some sort of resentment in their teams. And so I'm wondering how you have addressed that in your companies, or if you have received pushback from employees that do not have children.
Great question.
Yes. Answer is yes. Luckily, leadership is on board, and so they can help soften that a bit. We did have one department that was pushing back really, really hard and wanted a monetary gain for employees. They wanted something like a check, just a check written to people who were not going to use the child care center. And they didn't end up doing that. And there was a lot more people who came out of the woodworks that said that just having children on campus was a benefit. And that when we run down to the duck pond and when we go past their windows, they all come to the windows and wave at the kids. And when they come to fix something in our yard, the kids are really interested in all the tools that they're using. And so that has outweighed
we had a challenge with that too, that inequity issue. But what we did was, I mentioned the dependent care dollar benefit. we came up with a flexible benefit plan where you could choose where you put those dollars. And the amount of dollars was based on seniority of the company. So some people chose to put it in dependent care. Others said, I want that in my 401k, or I want that in my HSA, et cetera. We gave them a number of 5 or 6 different buckets they could put it in. So that's how we got around the equity issue, because it is a challenge.
I guess I don't see equity and equality as the same. So we have benefits, for example, we have bereavement benefit. Not everybody's gonna die in your family, but it's there if you need it, right? And so I think you just have to really challenge people's paradigms of how they think about things as well, and make sure that the organization matures in a way that you need them to as well. So I would offer you that.
All right, one more round of applause for our panel.